Good evening. My name is Mary Wittenhall, and I am the nurse practitioner and program coordinator at the Rhode Island Hospital Pulmonary Hypertension Center. I'm very excited to participate in this webinar, and I have done similar presentations to this for PHA in the past.
And my name is Nicole Reed. I am a registered nurse and clinical toxicologist, and I'm also a pulmonary hypertension patient.
Okay, so we're going to start out with the objectives for this webinar. The first objective is obviously to have a better understanding of the impact of sodium, fluids, and excess calories in pulmonary hypertension and how this affects the body of a pulmonary hypertension patient. Next, we want to make sure that we learn about better alternatives for foods that are commonly high in sodium. And then the last part is developing some real-world strategies or hacks to help with healthy eating that will fit one's lifestyle. So just a little background on nutrition. You hear this all the time, I'm sure, in clinic, that it is really important to eat a balanced diet. Sometimes medications require that, you take them with food, and you do want to make sure that you are getting your calories from three main sources: carbohydrates, proteins, and fats. And we'll get into the details of these a little bit more as the presentation goes on. It is also important to have a diet that is rich in fruits and vegetables, choosing fish and chicken, lean meats over red meats, and also to take into consideration that how many calories you take in every day really also should be related to how active you are as a person. So, men and very active women can burn as many as 2,500 calories a day, and less active people burn somewhere between 1,800 and 2,000 calories a day. And as most of you probably know, that pulmonary hypertension can cause people to be more sedentary or to be less able to do the things that you could do perhaps before diagnosis. So there may be a lot of sitting throughout the day, and you may only burn about 1,500 calories, and your metabolism does slow down with decreased activity level. So common sense will tell you that if you start to eat more calories than the number of calories that you're burning every day, this is how weight gain occurs. So it's really important to have a good pulse on what you're eating, how many calories you're eating, and how active you are. To lose just 1 pound, it actually takes burning 3,500 calories. So think about that. Tips for healthy weight. We talk about body mass index. What is body mass index? It is a measure that is essentially a calculation of one's weight in kilograms and your height in meters squared. So to be considered of healthy body mass index, your number should be somewhere between 18.5 and 25. And if you are not sure how to calculate this, certainly, somebody at your center would be, happy to calculate this for you. And we do follow BMI pretty closely. It is important to try to keep your BMI within that healthy range, because when you start heading into the higher BMI range, this is when folks tend to develop other health issues like high blood pressure, diabetes. Obesity comes with, several consequences, unfortunately. And as we know, weight gain can be due to not being active enough, eating too many calories, and unfortunately then gaining weight. Having a poor diet, so it doesn't necessarily have to be overeating, it can be undereating as well. Not getting enough calories in your diet can cause lots of problems to your metabolism and even slow your metabolism down, that when you do start to eat regular, that you can actually gain weight. Medications can sometimes cause people to gain weight. Meds like prednisone sometimes will have that effect. So, being really conscious of what you're eating when you're on medications like this that do have possibility of weight gain are certainly important. And then fluid retention, which is something that we talk about a lot because it is certainly a concern in pulmonary hypertension. And sometimes patients come into the clinic and they're really not eating very much, but they gained 7 pounds in the last month. And I say, well, what are you doing? And, you take a look at their legs or their belly and they're really, really full and full of fluid. So that fluid can weigh quite a bit. So just, having a good, knowledge of how to manage your fluids, which we'll get into a little bit more in this presentation, is going to be really important. So the other piece to this is portion sizes. When you go out to dinner, I've heard that many restaurants, what they serve you in one portion can actually feed you for 3 meals. And now I've noticed that a lot of restaurants have started to put their calorie contents on their menus. You can get a nutrition guide from the restaurant so you can see just how many calories, how much fat, carbohydrates, etc., is in a meal from there. So, we oftentimes will go out to dinner and, polish off that plate, but it can certainly make you feel very, very full, can make you more short of breath. As your abdomen expands, it's harder to take deep breaths. And if you're eating a high sodium meal, can make you retain fluid. So, there's this thought that if you eat 3 small meals and 3 healthy snacks each day, which essentially works out to eating about 6 small meals or grazing throughout the day, will make your stomach less full. You never really have that sensation of severe hunger that you feel like, oh my gosh, I need to eat right now. And you probably will eat less. You'll eat healthier. Your breathing will be easier. You'll have better sustained energy because you're not going to be having spikes and drops in blood glucose levels. And over time, your metabolism likes this. So it helps to keep your metabolism in balance. Other recommendations that we would say in regard to portion sizes. You also want to watch foods that can cause gas and bloating. Some vegetables can certainly do that. These foods can certainly make you feel very full at first, but you may find that you're in the bathroom, and lots of folks with PH are already in the bathroom quite a bit because most are on water pills and they're urinating a lot. So, this can even affect people's quality of life. So my recommendation would be everything in moderation. And if you know that there's a trigger, something that is going to cause gas or bloating, that, you eat maybe just a small portion of it and just be careful. And then eating a variety of food types. So, diversifying what you eat. Some people are fine with eating the same thing every day. Others, need to switch it up. But I think the key here is planning. So planning what you're going to eat for the week is important. Just get a notepad, write it down, write the things that you like. And, you may have a cheat meal here and there. That's okay. But you really want to focus on trying to plan, because if you plan, then, you're more likely to eat better because you're very conscious of what you're doing. Learning how to read labels and understanding the serving sizes. So, if you look at a label, it will explain under the nutrition facts how many servings is in one package. And oftentimes you look at the package and you think, well, this looks like it's 1 serving, but then the package actually says that there's 2.5 servings in there. So whatever the number of calories, carbohydrates, sugars, etc., whatever that content is listed for 1 serving. So if you eat the whole package, then you have to multiply that by 2.5. So it is really important to have an understanding of portion control. Having a scale, they sell very simple scales. You could get it like Bed Bath & Beyond or even Walmart, that you can measure how many ounces something is if you're not sure. Will help you guide, as far as how much you're taking in. And if you're eating things like meats or nuts, you can take your fist and make a fist. And that size, the size of your fist should kind of dictate how much you should be eating. So if you're eating something beyond that size, then it's usually probably too big of a portion for you. And then also, if you eat all of these major food groups, especially diversifying your diet, whole grains, fruits, and vegetables, then you are eating foods in their purest form. So there's no added sugars, there's no processing oftentimes, and there's usually low sodium, low fat content. I've also heard from dietitians that they recommend when you go into the supermarket, if you shop in the perimeter of the supermarket, you're more apt to make healthier choices because you think about, the, well, we don't talk about the bakery, but, the produce is on one side, and then toward the back, you've got, dairy. So there's, a pretty good diverse choice of foods. And I think it's a good rule of thumb. So sodium is something that we have innately in our bodies, but common salt, known as sodium chloride, is it's in lots of foods. It is in table salt, and it is in our blood, and it actually helps to maintain red blood cells and to help proteins dissolve in our blood. Sodium is extremely important. It is an electrolyte that we check when we do blood work for patients, and we check electrolyte levels. So it is important to have the right amount of sodium in your diet because it helps with the fluid balance in the body. Sodium is also responsible for things like conduction of nerve impulses and muscle contraction. And sodium and potassium are both really, really important in the electrical activity of the heart. So too little can be dangerous and too much can be dangerous. So most of the sodium that we eat comes from, unfortunately, packaged, processed, store-bought foods, restaurant prepared foods, and oftentimes the sodium in these foods is way off the charts. So small amounts of sodium can come from adding it at the table or during cooking. So, typically I'll recommend to my patients that if they are cooking and they are using things like canned vegetables or anything that's processed, that they're not adding salt to that recipe when they're cooking it. And, sometimes it's a habit thing. Like I've seen people just sit down at the table and go right for the salt shaker before they even try the food to see what it tastes like. And at first, if you're used to putting salt on your food or you're used to eating really salty foods, it's an adjustment for sure. I mean, it's hard to eat something and to change a habit. But if you do it for at least a couple of weeks, when you go somewhere and you eat something that is, salty, you will notice it for sure. So I think it's just really important to sort of be cognizant of that, when you're doing your daily thing. So on average, the average person consumes actually about 3,400 milligrams of sodium a day. And the American Heart Association recommends, they were recommending 2,000 milligrams of sodium a day, but I've heard that they're actually looking to even decrease that further, somewhere in the neighborhood of 1,200 to 1,500 milligrams of sodium a day. And that's typically what I recommend to my patients. Again, it's really patient specific, but going and having a meal at McDonald's, you get all of your sodium, daily sodium, in one meal and then some. So the American diet is very, very full of sodium. And like we said, sodium is important, but it is in lots of things that we don't expect. Things like salad dressings, sauces, marinades, even some frozen vegetables that have like a garlic herb seasoning in them. You'll find that in there. Anything that's like a packaged pasta, you may find that in there. So it's really, try to prepare as much as you can from scratch. I know it's really hard. And then if you can't do that, then look for some of the low sodium options that are available. Just so we can even give you a few more examples here. A slice of bread can have as much as 230 milligrams of sodium. Deli meats are also a really big culprit. Turkey, even if you buy the low sodium turkey, can have about 1,050 milligrams of sodium in just one slice. And then half a cup of cottage cheese can also have 411 milligrams of sodium. Okay, so the reasons that we get really concerned about sodium are because if you have too much sodium, it can lead to hypertension. Now, not pulmonary hypertension, we're talking about the systemic high blood pressure, the blood pressure that you measure on your arm, because salt and water have this very strong relationship. Wherever salt goes, water follows, because if you have too much salt, then you retain fluid, and then that will then in turn increase how much blood is circulating through your body, increase your cardiac output, and lead to high blood pressure. As we already discussed, sodium can increase your weight, and sodium also stimulates the sympathetic nervous system and the adrenal glands. So it can create a stress response, which sort of puts your body in this uneasy state. And oftentimes, if you have this stress response, it can lead to things like weight gain. So, again, just really being cautious here is very, very important. The kidneys, excess salt can also make them work really, really hard. And then over time, it can weaken their function. And as many of you know, we are really, really cautious about kidney function in pulmonary hypertension. Many of our patients are on diuretics. Some are on moderate to high doses of diuretics that do put strain on the kidneys, but are really crucial for managing the heart and lung function together and avoiding right heart failure. So we do want to preserve these kidneys as long as we can over time. And you can also develop uric acid buildup due to high sodium content, which can lead to something called gout. Some of you may be familiar with this. You can get inflammation and swelling in the joints or tissues. People tend to get it like in their ankles or in their legs, and it's very, very painful. And oftentimes if you do get it, you may be prone to get it again. So watching how much you eat, and there's, for people that have had gout, there's whole recommendations about what you should and shouldn't do for diet. And then finally, it can also be responsible for possibly making blood vessels less flexible. So stiffening of the blood vessels may lead to atherosclerosis, which is hardening of the arteries. So this can, potentially lead to coronary disease, which is not something that we want our patients to be experiencing when they already have other health conditions. And as we said, wherever salt goes, water follows. So it's really important to also monitor how much you drink. So the body is going to try to regulate fluid balance, but you do play a very key role here in making sure that that you know how much you're drinking and how much sodium you're taking in. So lots of patients will say, well, I come in here and one doctor will tell me that I need to drink more, 8 glasses of water a day or more. I'll say, well, it's a little bit different in pulmonary hypertension because we have to really, really keep a close eye on this, fluid and sodium balance. The fluid can lead to weight gain. It can put strain on the right heart, can make it harder for your heart to pump, can make you more short of breath. The kidneys will work harder. So, unfortunately in pulmonary hypertension, the 8 glasses of water a day may not be the case. And again, I speak in general terms. This is not the recommendation for all pulmonary hypertension patients. You should certainly review this with your care team as in regard to what their recommendations are. So we will make some general, we'll have a general discussion about what we consider, an adequate amount of fluid to be taking in every day. And salt in any form, doesn't matter if it's, table salt, sea salt, kosher salt, Himalayan salt, they all can cause fluid retention. So just keep that in mind. So fluid retention, as we talked about, can make your legs swell up, can make your abdomen very bloated, you can gain weight. It makes it really hard to breathe, and it can make you very, very tired. And again, drinking too much in pulmonary hypertension can really do a number on you. So, lots of my patients will say, well, I'm on these high doses of diuretics, my mouth is dry all the time, all I want to do is drink. So we've got lots of little tips, things like taking a glass and filling it with ice chips and eating the ice chips with a spoon. And if you were to take that glass and let all of the ice chips dissolve, the glass would probably only be about half full. So you will quench your thirst by, just taking a few ice chips here and there. And certainly it would take longer to get through the ice chips than it would to just drink a full glass of water. Drinking through a straw is also helpful. It makes you drink slower, taking small sips. And then having a water bottle that will tell you just how much water is there is also going to be important. And then if you can manage this balance, then you're good most of the time. Most of the time, we try to stay on top of these things in the outpatient world. But if folks are not following recommendations or missing doses of diuretics, eating too much sodium, drinking too much water, then we oftentimes get to a point where we say, there's just too much fluid on board here, and it's dangerous for us to try to give you higher doses of water pills, and probably not very effective. So at that point, we recommend that patients come into the hospital so that they can get more diuretics that can be given through an IV. So a little bit about label reading. If you don't know how to read a label, I would encourage you to take some time and learn how to do that. They're pretty easy now. They're broken down where it will tell you under nutrition facts a serving size is 1 can and how many servings in that container. They consider there to be 3.5 servings in 1 can. So maybe you think you could polish one off in one sitting, but really, there's quite a bit more. And just in, excuse me, 1 can, in one serving, there's 520 milligrams. So think about that. If you eat all 3.5 servings, then you are well into your sodium limit for the day. And sodium is, in things, like I said, lots and lots of things. It's even in unprocessed foods. So fruits, vegetables, they do not have naturally occurring sodium. They're usually small amounts of sodium, much smaller than what you would find in processed foods, but something to consider. In meats, pork, cured meats, all of that, has quite a bit of sodium in it too. Okay, so make sure that you read your labels, and you will, I think you'll do well. Okay, so there's lots of hidden sources of sodium in our diet. We talked about a few of the culprits already: bread, butter, soups, cheese, canned items, deli meats, baking soda. Medicines sometimes have sodium too, things like Alka-Seltzer, other dissolvable tablets. So always check with your team and make sure that what you're taking is okay. And then this is a nice little picture that we found online. Just goes to show you how much sodium is in some of these foods. At this point, I will turn this over to Nicole, who is going to share with us some tips on healthy snacking and life hacks.
So first I'm going to talk about some general strategies, and then I'm going to talk a little bit about my experience with managing the sodium in my diet, and hopefully some of the hacks that I've found will also help you. I do recommend that you always read the ingredients list. I know we're kind of harping on reading the labeling, but it's really important. And generally, a smaller list is better. If there's a lot of unpronounceable stuff in there, it probably means it's pretty processed. And the more processed something is, the more salt you're going to find in it, generally speaking. Products with more ingredients also have a lot of fillers, chemicals, sugars, empty calories as well, and are just generally not as good for you as whole, real food. Some examples of healthy snacks with just a few ingredients are things like almonds, walnuts, or peanuts, really any kind of unsalted nuts or nut mixes, fresh fruits and vegetables, unprocessed or minimally processed cheeses, and plain yogurt with fresh fruit. You tend to have a lot more sugar and calories if you buy the yogurt with the fruit in the bottom, so you're probably better off just getting the plain yogurt or even the vanilla yogurt if you really hate the plain, and adding your own fruit. I generally would recommend that you avoid eating 2 to 3 hours before bedtime, and the reason for that is because a lot of us also have reflux with our medications or other medical conditions that we have. And so if you're eating and then going and laying down right away, you're more likely to have symptoms of heartburn, acid reflux, and it's going to disturb your sleep as well. And we all need our rest. I recommend remaining sitting for at least 60 minutes after eating to aid in digestion and, again, decrease those acid reflux symptoms. So eating a meal and going and laying down on the couch is just as bad as eating a meal and going right to bed. You'll want to remain upright so that you can digest a little bit better. And then letting your body recover and repair for the night is really the goal of getting a good night's rest. And if you take in a lot of food and then go straight to bed, or if you have something with a lot of salt in it and then you're drinking a lot of fluids because you're thirsty, you're going to have your heart pump more blood. Your digestive system is going to be working hard. Your blood's going to go to your stomach and your intestines, and it's going to disrupt your sleep and your rest. You really do want to give your body a chance to repair itself and prepare for the next day. So in terms of some of the life hacks that I found is I try to look for the lowest sodium or no sodium bread. It's usually in the organic or frozen section of the grocery store. Sometimes it's even the frozen organic section of the grocery store. And Ezekiel is one of the popular brands that I've been able to find at pretty much all the grocery stores in my area. They have a few different varieties, but there is one that's marked low sodium, and it actually has no sodium in it at all. So at first it kind of tastes bland compared to regular bread, but once you start really embracing a low-salt diet, it actually tastes very normal. And when you have a piece of regular bread, you think, oh my goodness, how salty is this? I can't believe I ever ate this before. For baking, this is where a lot of us can run into trouble because baking powders and baking sodas have a ton of salt in them. And there are actually a couple of brands of baking powders and baking sodas that have substitutes in them. They contain things like potassium and magnesium. So, of course, you want to run this by your doctor as well. If you're allowed to take or if you're allowed to use the sodium supplements like Nu-Salt or Also Salt, you're probably going to be okay with these as well. But if you have kidney problems or things like that, you want to run this by your doctor. If you can't find them in the store, they are available online. I actually buy them on Amazon because they're kind of unreliably stocked in my grocery store. Sometimes they're there, sometimes they're not. The baking soda substitute that I use is called Energy, and the other the baking powder that I use is called Featherweight. And so you can find those in a lot of grocery stores. There are lots of no salt or low salt peanut butters or nut butters, and these are often found in the organic section, but not always. Sometimes they're just among the regular peanut butter. And a lot of them are the more natural unprocessed peanut butter, so they also don't have the partially hydrogenated oils and things like that that are not good for you, the preservatives and those kinds of things. When cooking, I found that a splash of vinegar can really trick your tongue into tasting salt. It's a nice sharp taste, so you kind of get that tangy sensation without any of the added sodium, because vinegar itself doesn't have salt in it. And I use it, I just put a splash in sauces or soups, and it gives me the sensation of having something salty when it's not actually salty. And then I look for a lot of no salt spice blends as well, and these are really great for dressing up salads and meats, vegetables, homemade soups, or even there are a few canned soups out there like Health Valley Organic. They make a no or low sodium soup, and it doesn't taste as salty as regular soup, obviously. So you kind of need to dress it up a little bit to make it really have a little bit more flavor. And I find that I actually don't miss the sodium as much as when I first started and didn't have any of these spices. Also, Mrs. Dash makes some blends, and they're in the grocery store, just in your spice aisle. And don't be afraid to play around. You never know what you're going to end up liking. In terms of restaurants, it's really hard because you really can't control what you're getting with the restaurants. So when I eat out, I try to avoid or minimize dressings, sauces, and breads because a lot of salt is hidden here. I ask for plain oil and vinegar on a salad, and then I maybe put some pepper on it, skip the salt, or ask for things on the side, and that way I can control just, a taste of it. Sometimes I really do want that bread, but I'll limit myself to maybe a slice or a half a slice, something like that. I usually ask the chef or ask the server to ask the chef which items on the menu can be prepared without salt, and they're usually able to tell you. A lot of times, if you ask for burgers or steaks unseasoned, they can do that for you. The seasoning is usually salt-based, so they just hold that, and it's just a plain piece of meat that they can grill or cook up for you, and then your sodium intake is limited to what would be naturally found in the piece of meat itself. I usually tell my server that I have a heart problem or a heart condition because I don't want to get into the whole pulmonary hypertension thing, and it's really none of their business anyway. But I find that they're more likely to pay attention and get the message to the chef when you actually just tell them, hey, I have a heart problem, because they don't want you dropping dead in their restaurant or, having to call 911. And that's what people generally think about if you say heart problem. I really enjoy vegetarian food. I'm not a vegetarian, but I like the food. But you really have to be very careful of vegetarian items that are prepared in restaurants, because these are usually very heavily salted. They're heavily seasoned compared to meat, and they put a lot of salt in them to try to bring out the flavors. Another thing that I do is I try to check the restaurant's website before I go and try to plan my meal if they have any nutrition information available. A lot of places do have information about calories and fat content and protein and all that stuff, but they don't often include the salt. So it's really hard to know if I'm able to get something without sodium. So I kind of just have to look at the menu, try to pick the least saucy, least processed thing on the menu, and then talk to the staff at the restaurant to see what they can do to minimize it even a little further. And I'm going to pass it back to Mary at this point.
So back to managing fluid intake. We did touch on this a bit before the hacks, which were awesome. So thank you. But if you are retaining water, oftentimes your team may say to you, I think we need to really look at how much fluid you're drinking every day. So I already mentioned that you can buy a water bottle that you drink out of every day that is measured so that you know how many ounces you're taking in. And then also, taking into consideration that it's not just water that you're drinking or iced tea or juice or whatever it may be that you do drink. It's other things too. So it's the liquid that's in soup. It's anything that can be melted down into a liquid. So if you're eating ice cream, Jello, that all counts toward your fluid intake. So, we talked about a lot about what we should do as far as restricting sodium in our diet. And oftentimes in the hospital, we call this a no added salt diet, understanding that there is sodium in foods already. So we're not just adding additional salt to that. And as Nicole also mentioned, we do encourage people to look for salt substitutes, but some of these substitutes can also be dangerous. They can contain potassium and magnesium, which also are electrolytes that we pay close attention to with folks with pH, and they can affect your heart's function if you have too little or too much. They can also impact your kidney function. So it is, again, always good to just check with your team and make sure that this is okay. Water pills, as we said, do make you thirsty. Drinking too much can certainly tip you over the edge. There are things like ice chips, mints, mouth moisteners. There's some stuff called biotin. I also heard from another patient of something called Oasis that was recommended to them by their dentist that comes in different flavors. If you can get it on Amazon, and it does help to keep the mouth moist throughout the day.
And if I can just add something that worked for me too, on a day when maybe I've already had enough to drink really and I shouldn't be having any more, sometimes I'll just take the water and rinse my mouth with the water and spit it out. Then you're not really absorbing a lot of the water, but it can make you feel a little bit better. It doesn't make you feel so dry.
Mm-hmm. So when you are prescribed water pills or diuretics, we do encourage patients to weigh themselves every day. And I instruct patients to weigh themselves around the same time every day with the same amount of clothes on. If you have a bowel movement in the morning, have your bowel movement. Before you get into the shower, get on the scale with your undergarments, and then get your weight. So we do watch for fluctuations on that scale. And you do want to be cautious that if you start to gain somewhere in the neighborhood of 3 or 4 pounds in a week, then you should contact your clinic and let them know about this. Other things is, maybe the scale may not say it to you, but you notice that you're retaining fluid in your feet, in your legs, in your hands, in your belly, and your breathing is not as good, then, maybe you've only gained 1 or 2 pounds on the scale, but it would still be important to just, give a call to your pH center and ask them what they would recommend that you do. And, keep a food journal. So if you know that you ate something really salty, and now you're at this point where you've gained 5 pounds, and you know that you're going to, be out at a function or something in a few days, and you're concerned that you're going to eat more, sodium, then please call us and let us know. I mean, we want to avoid you from, coming into the hospital. I was a heart failure nurse before I became a nurse practitioner, and I remember at Easter time we used to have lots of patients get admitted to our unit with, volume overload because they were eating ham dinners, and there's lots and lots of sodium in the ham, and then all of the fixings on the sides. So just, be honest with yourself, be honest with us. We're really here to help you. We're not here to give you a hard time, but we do want to try to keep things in balance. And Oftentimes, you do need to take potassium pills because your potassium level may be low. Your team would tell you this, that if your potassium level was low from being on diuretics. Some of the diuretics do help you hold on to potassium, but the loop diuretics, diuretics like Lasix or Bumex, oftentimes make you just give away that potassium. So like we've talked about earlier, potassium is really important in heart function. So we do, want you to get your labs checked regularly. As far as a fluid restriction, again, this is just a general recommendation. I would ask every patient that if they have any concerns about their fluid intake, that they do speak to their team about this, and that the team will help them determine what the best amount of fluid is for them every day. So a typical rule of thumb that we recommend is somewhere in the ballpark of 1.5 to 2 liters of water or fluid a day. That works out to be about 50 to 60 ounces, which is roughly 1.5 to 2 quarts, which is roughly 6 to 7, 8-ounce glasses. And these are the smaller glasses, not the tall glasses. The smaller glasses are usually somewhere in the ballpark of 8 ounces. The taller glasses are 10 to 12 ounces. So keep that in mind. Anything that can be melted into liquid, as we talked about. And if the item is solid, as a liquid measure, such as a gallon or ounces, consider that to be a liquid, like the ice cream we discussed. Okay, so takeaway messages from our presentation. Good eating habits is really key. Managing your sodium and fluid intake are also going to be really, really important. Own your nutrition, okay? It's up to you. Be honest, write everything down, and be able to go back and reflect on it. So it'll help you gauge, what you can and what you cannot do. Learn how to read labels. If you need more information about how to read a label, there's lots of websites that are helpful with this. mypyramid.gov also gives you some really good tips about diversifying your diet, so choosing from different food groups and recording your weight. Excuse me. So watching for any significant fluctuations and any swelling, shortness of breath that you may be developing. Processed foods, so really keeping an eye on processed foods, prepared foods, restaurant foods. And if you don't know how much sodium or calories will be in a meal that you're going to eat, then you probably shouldn't eat it. But again, we all deserve to have a little pleasure at some point. So, I tell my patients you can have a cheat meal, maybe twice a month. So just keep that in mind and plan ahead. As Nicole said, if she knows she's going to be going out to dinner, then she'll sort of prepare that day what she's eating, so that she is able to conserve her sodium and calories for that meal that she's going to be eating out. So if you are on water pills, be careful about becoming dehydrated, but don't assume because your mouth is dry that you are dehydrated. In the summertime or in warmer climates, you may find that you may need to drink more fluid than what I mentioned. And again, that's a conversation that you should have with your team. They'd be able to recommend, what is appropriate for you. And of course, signs of dehydration. Severe fatigue, dizziness, lightheadedness can sometimes cause that drops in your systemic blood pressure. So, your team can help you sort through that. And know when to call your pH doctor and report anything that is concerning to you. Don't wait and say, I have a visit next month, I'll go over it then, but you've gained 7 pounds already in just the course of 2 weeks. So again, we like to know about these things ahead of time.
And if I could just add one thing, as a patient, I know how hard it can be to restrict sodium. I mean, no one loved salt more than me before I got sick. I would very commonly salt a pizza and eat the vast majority of the pizza myself. So it's really hard at first, but you will get used to it, and you won't really miss the salt after a while. Things that you never noticed salt in will taste salty to you if you have them. And there's so little about this disease that we can control, but the one thing that we can all control is what we put in our mouths, and our diet is really important to maintaining, the best health that we could get for ourselves.